Hello, welcome to my channel. My name is Dr. Frank Amokohini, a medical doctor and a medical laboratory scientist, and of course a politician, but I'm not here to campaign. I'm here to discuss with you a topical issue, G6PD deficiency. G6PD is an enzyme, and it is much more important in this context in regards to the red blood cell. So your blood has the red blood cell, the red component, and it's a white blood cell, of course. So it is that red component, if I may put it, that is what is important to us now. That red blood cell helps carry oxygen from your lungs when you breathe in. Okay, it carries oxygen from your lungs all the way to your body cells in all parts of your body. Okay, so when that red blood cell has this deficiency in terms of G6PD, then what happens is that it's not able to withstand pressure, which we call oxidative stress, and it gives in and it is destroyed, and it is that sequence which leads to all the complications we will talk about when it comes to G6PD deficiency. So the G6PD enzyme helps the red blood cell to produce a reduced form of NADP into an NADPH, and that helps the red blood cell again produce an antioxidant that we call glutathione. The red blood cell depends on that pathway alone to be able to produce the NADPH, which is needed to produce the glutathione. So when you have a deficiency in the enzyme, then what it means is that you will not be able to produce that antioxidant, the glutathione, and the red blood cell will not be able to withstand pressure. I'm sure at this point you are confused with the medical jargons, but what I mean, or what in a nutshell we seek to tell you, is that this whole systems, these whole enzymes, ions, antioxidants, help the red blood cell to withstand pressure, which in our language we say oxidative stress. I hope that is clear. So yes, so that is it with the whole concept of G6PD deficiency and how it affects the red blood cell and why it makes the red blood cell susceptible to destruction or hemolysis. It is destroyed and it causes a lot of problems in your body. So it's airborne, waterborne, foodborne, whatever. No, it is not. It is genetic. It is genetic. You pass it onto your offsprings, okay? So your mother can pass it on to the children, okay? And it is excellent, meaning that it is associated with the X chromosome. So females have XX. So if one of the X is affected, the other X may cover it up. Males have XY. So if the X is affected, that's the only X, obviously. So more males do have the condition compared to females because of the nature of its inheritance. So yes, if you marry someone, you cannot pass on a G6PD deficiency to your wife or to your husband, but of course you can pass it on to your offspring. But the key catch here is that how would you know if you have G6PD? Childhood, there may be a reason to suspect same. And usually in the neonatal period, the first 28 days of life, the child may develop what we call neonatal jaundice. And any child that develops neonatal jaundice, definitely on top of our mind, we need to rule out G6PD deficiency. So we will do all the labs, we take all the history, we do all the things to make sure we rule out G6PD deficiency. The child will be jaundice. There will be yellow discoloration of the sclera, the mucous membrane, the conjunctiva, and all that. And the child may be passing cola-like urine or dark-colored urine. Okay? The skin may also become very yellow. Okay, so in the investigative process, we may come or chance across a G6PD deficiency condition. If you are an adult, obviously you can equally develop the jaundice. You can equally be passing a dark-colored urine or the cola-like urine. So all these will point to the fact that you may be having a G6PD. Of course, other conditions can cause all these symptoms, including sickle cell disease, even malaria can cause all these. But of course, we are talking about G6PD, and these are also found in G6PD, the reason for which I'm dwelling on them. In G6PD, there is a type we call the A plus, and there is a type we call the A minus. The A minus is much more severe as compared to the A plus. Okay, that notwithstanding, WHO has classified it into 5 classes: I, IV, and V. The I is the most severe form of the G6PD. The II will be followed by the III, then the IV, and then the V. The IV and the V, usually patients with that form of defect do not develop symptoms, and of course they are not people we really worry so much about. It's the I and the II especially that do develop much severe symptoms. Okay, one of the common terminologies you also hear is a partial defect and a full defect. So the full defects, usually the I's and the II's are known as the full defects, and the III, IV, especially IV and then the V are the partial defect group. So they hardly, the partial defects, they are not likely to develop symptoms or to run into crisis. Okay, so yes, you are deficient of G6PD. What is the headache here? The headache here is that you can undergo oxidative crisis or oxidative stress, which in this video, let's say there can be pressure on the red blood cell, and when that pressure is on the red blood cell, it may not be able to sustain or be able to handle that pressure, and definitely it will hemolyze or it will be destroyed. Okay, so there are 3 of them that can trigger a crisis. The first is infection. Any form of infection can trigger a crisis. Okay, food. There is a bean called fava bean. Okay, it is notorious for instigating a trigger. The third is medications, drugs. So sulfur-containing drugs can trigger a crisis. When you encounter a trigger, be it infection, drugs, food, within 24 hours to 72 hours, you may develop symptoms. And the good thing is that you may recover between 8 to 14 days with usually some minimal interventions. But there is a need for an intervention. Okay, so don't just be at home and be self-medicating when you have any form of G6PD crisis. The danger there is that the content of the red blood cell, which is the hemoglobin, is toxic to the kidneys. So you may run into an acute kidney injury or failure. So you want to come to the hospital and get the needed intervention where necessary. The catch here is that anyone who is diagnosed of G6PD is given a card. You are presented a card by the medical facility. That card has a list of drugs you should avoid, food you should avoid, symptoms you should look out for, and all that. So once you have that card, anytime you visit a hospital, a pharmacy, any health facility, volunteer that information. Volunteer that information unsolicited. Anytime within the consultation, even before the doctor asks you, volunteer that information. Okay? The onus rests on us, the medics, to do a thorough past medical history and be able to tease out some of these conditions. Okay? But you see, there can be charges of negligence and all that, penalties whatsoever. But remember, it is your health, and you have it just once, and you need to protect it with all your might. So anytime you enter a health facility and you know very well that you have G6PD deficiency, volunteer that information. Let your doctor be aware that you have that condition. And I'm sure that any well-trained health practitioner will know what to and what not to prescribe so far as the condition is concerned. So, ladies and gentlemen, I want to thank you all for your attention. If this video was helpful to you, subscribe, share, comment, and like this video.